A very good evening to Dr. Hema and my fellow friends. We are from Group 2, and my name is Ryan.
My name is Hui En.
My name is Chloe.
I'm Jessie.
My name is Sing Hong.
My name is Ying Wen.
My name is Gavin.
And today, we're going to be presenting about the medical negligence in England, Wales, and Malaysia. Now, first and foremost, let's start with the foundational principle of medical negligence, that of which being the duty of care. The law imposes a duty of care on all medical professionals to take reasonable care when dealing with patients. Now, that means that doctors, nurses, and other healthcare professionals must act in a way that protects their patients from harm at all costs. Now, when a healthcare provider fails to meet this duty, that could cause a breach of that duty and therefore leading to medical negligence. Now, the question is, how do we determine whether a breach has occurred or not? Traditionally, the standard of determining whether a breach has occurred or not is found in the Bolam's test, the first test. Now, according to Bolam versus Freen Hospital Management Committee, a doctor will not be deemed negligent if they act in a way that is supported by a reasonable body of medical experts, even if that practice is not widely accepted. In short, the law imposes a duty of care on the doctors, but the standard of care of which they carry out that duty is a matter of medical judgment. As long as their actions are consistent with what all the other competent professionals are doing and would do in the similar circumstance, they will not be found negligent. This test emphasizes that medical practice is often subjective and dependent on expert judgment, which can vary between doctors. Over time, the courts have clarified that medical judgment must not only be supported by a responsible body of medical opinion, but they must also be logically defensible. Now, that was established in the case of Bolito versus City and Hackney Health Authority, where the House of Lords ruled that just because a medical practice is supported by some medical experts doesn't necessarily mean it's defensible at all. In Bolito, the court stated that the medical opinion relied upon must be one that can withstand logical scrutiny. This means that a doctor could still be found negligent even if there is some support to their actions within the medical community, if that practice itself is deemed unreasonable or flawed. Now, all up to this point, the standard of obtaining consent was largely focused on what the doctor thought was the best for the patient and completely disregarded the patient's own opinion. However, the case of Montgomery versus Lanarkshire Health Board completely shifted that focus. The court held in this case that the doctors have a duty to inform patients of material risk involved in the medical procedures that they are about to undergo, a risk that a reasonable person in that patient's shoes would like to know. Now, this case prioritizes the patient's right to make fully informed decisions about their healthcare, ensuring that they are aware of the risk, benefits, and even any other alternative treatments about their procedure. Now, as a result, the Montgomery decision has had profound implications for patient anatomy and informed consent in England and Wales, marking a major shift towards recognizing the patient as an active participant in their healthcare decisions. Now, that's all from me. I'll pass it on to the next person.
Here is the Bolam test determine that medical negligence based on whether a doctor actions align with the accepted by a responsible body of medical professional. In this case was Cedar West versus Board of Governors of the Bedlam Royal Hospital in 1985. The claimant, which is Mr. Cedar West, underwent a surgery for spinal conditions. After the surgery, she suffered a significant complications including paralysis, which led her to claim that she was not adequately informed about the risks associated with the procedure. This case revolved around whether the surgeon had fulfilled their duty to disclose the potential risks and whether this failure constituted negligence. On hearing that, the House of Lords ruled that medical professional has a duty to inform the patient about the risks involved in the treatments. However, this duty is satisfied if the professional act according to the accepted medical standards. The court applied the Bolam test to determine if the surgeon actions are aligned with the acceptable practice of the medical opinions. But the defense argued that, based on the expert testimony, the risk has disclosed of the standard practice of the time. Ultimately, the court found the doctor not negligent, and the court dismissed Mrs. Sidaway's claims due to the insufficient evidence that the surgeon had failed to meet the required standard of care defined by Bolam. So in this case, confirm that doctors are judged by the professional standard of their field, but not what the patient expected. And here we can see is the Lord Diplock views in Sidaway suggested that doctors found not negligence if they follow accepted medical practice. He emphasized the role of professional judgment in disclosing risk. However, as the time passed, this view has been debated. Many now prioritize the patient autonomy and has the duty to inform the patient about the material risk. Here also has Sidaway also reaffirmed the Bolam test. It also explored its limitations, particularly in addressing issue of patient autonomy. Here got two criticisms of Bolam in Sidaway's. The judgment highlighted the tension between the professional judgment and the patient rights to make the informed decisions. It may also allow some traditional but potentially unreasonable medical practice to avoid liabilities, as courts typically do not delve deeply into whether the medical experts' opinions are logical. While Sidaway upheld the test's traditional applications, it also explored its limitations in addressing informed concerns, and this provided space for reflections on the development of the Bolam test, leading to greater emphasis on patient autonomy and informed concerns. While the Bolam test depends on the presence of the respective body of the medical opinions, and now the Bolito adds a layer of scrutiny, the court must assess whether the medical judgment is logically defensible. Now here's the cases of Reynolds versus North Tyneside Health Authority in 2002. This case involved a claim of medical negligence arising the care of providing a pregnant woman in a Tyneside hospital. The central issue was whether the failure of the attending midwife upon the perform a vaginal examinations upon the woman admissions to the hospital. These omissions lead to the tragic developments of an undetected umbilical prolapse, and which in turn caused the baby to suffer asphyxiations and resulting in brain damage and cerebral palsy. So there were two main issues that the court needed to be addressed. The first is whether the midwife have adhered to the appropriate standard of care. Specifically, should the midwife have performed a vaginal examinations, as this is crucial to confirm that whether she had met the expected level of standard of care in the circumstance. So secondly, the court also have to decide if the failure to perform a vaginal examinations directly caused the child cerebral palsy. This is the link where between the omissions and the resultant harm needed to be established. So a key part of the case was use of the Bolito test, which checked if medical decisions are logically justifiable. The defense argued that the experienced midwife might choose not to do a vaginal examinations, but the court used the Bolito test and decided that a competent midwife would have seen the examinations was as necessary, so the court rejecting the defense argument. In the other side, the defense expert also argued that not performing the examination will be within the acceptable medical standards. But the courts, since that these decisions was not logically make sense. A simple vaginal examinations, which could have detected the prolapse, might have prevented the asphyxiations and spared the child from the damage. The court ruled that the midwife actions were not logically justifiable and deemed them negligently because it directly caused the harm to the child. As a result, the medical authorities were held responsible for the child injury. In a nutshell, this case shows that the Bolito test makes sure medical decisions not only follow the professional standard, but also need to be logically reasonable. It also reminds us that the Bolito test is an important tool for checking if medical decisions are safe and reasonable for the patients. That's all for my part, and now I would like to pass to my teammate.
So I'm going to talk about the shift of Montgomery test with this case McCulloch and Forth Valley Health Board. This case is the significant development in context of informed consent to the patient, and particularly in relation to the landmark case of Montgomery and Lanarkshire Health Board. McCulloch was readmitted with pleuritic chest pain with the Dr. Catherine, a cardiologist, assessed him, and she determined that prescribing NSAIDs like ibuprofen was unnecessary due to he has the absence of symptoms such as chest pain or dizziness. Additionally, McCulloch has a history of gastrointestinal issue. It will make NSAIDs potentially harmful. So McCulloch was admitted to Forth Valley Royal Hospital with severe chest pain, and tests suggested possible of pericarditis and inflammation of the sac surrounding the heart. His condition was improved and he was discharged. However, he suffered a fatal cardiac arrest at home after a few days. So, the Supreme Court in McCulloch case reaffirmed that the importance of professional judgment in determining what treatment options should be discussed with patients. It held that Bolam test applies when assessing whether alternative treatment is reasonable and should be discussed with the patient. This means that doctors' decision not to discuss a particular treatment is valid if it is supported by a responsible body of medical opinion. The Montgomery case established that a doctor must take reasonable care to ensure that the patient is aware about any material risks involved in any recommended treatment and any reasonable alternative treatment. However, McCulloch clarified that the doctor is not required to discuss every possible treatment option, but only those that they consider reasonable based on their professional skill and judgment. The Supreme Court rejected the argument that the assessment of what amounts to a reasonable alternative treatment should be a matter for the court. Instead, it emphasized that this assessment should be made by the medical profession using their professional judgment and expert. This approach prevents the court from overriding professional medical decisions. So the decision in McCulloch has provided clarity and relief for medical professionals by confirming that they are not obliged to advise patients of all possible treatments, including those that they do not consider reasonable. This reduces the risk of overwhelming patients with numerous options, and it reinforces the importance of professional skills and judgment in guiding treatment decisions. So in this McCulloch case, the claimants allege negligence because the doctor did not discuss the option of using NSAIDs with Mr. McCulloch. However, the court held that the doctor's decision was supported by a responsible body of medical opinion, and therefore did not constitute negligence. The claim also fell on ground of causation, as it was not proven that the failure to discuss NSAIDs caused Mr. McCulloch's death. So, in summary, of this case has resolved the tensions between the Montgomery and Bolam tests, reaffirmed the role of professional medical judgment in determining what treatment options should be discussed with patient, and this decision maintains a patient as a center approach while ensuring that medical professionals are not too burdened by the needs to discuss every treatment option to the patients.
So here's a conclusion for the standard of care of medical negligence in England and Wales. There were total 3 tests that has been discussed by my group mates, which were the Bolam test, Bolitho test, and the Montgomery test. I will briefly conclude what are these 3 tests about. So first, the Bolam test. It is to determine whether a medical responsibility has acted according to a responsible body of medical opinion. For the Bolito test, it is to refine the Bolam test by adding another layer of scrutiny where the courts could reject the medical opinion if it seems to be unlogical or unreasonable. Well, for the Montgomery test, which is the third test, it is to disclose all the material risks to the patient, no matter if the risk is unreasonable or rare. Everything needs to be disclosed and discussed with the patient before letting the patient to choose whether to start or to go on for a treatment. 3 of these tests are still in use in the England and Wales to determine whether there's a medical negligence. To prove that, we can look at the McCulloch versus Forth Bradley Half Broad case that happens recently in 2023. In this case, 3 of these tests were in use. First, the court will look at the Bolam test. In this case, the medical professional's decisions to not offer the NSAID was supported by the medical body. And then in the second test will be the Bolito test. The medical opinion that's supported by the medical body seems to be logical and reasonable. We can see that there was no negligence or issues happening until the third stage, which will be the Montgomery test. The medical professionals choose to withhold the information about the NSAIDs to the patients merely because it was an unreasonable treatment to the patient. But here's the issues. The Montgomery test is to disclose everything to the patients, but in this case, the medical professional choose not to. That's why 3 of these tests are really important to determine whether there's a medical negligence happening. So in conclude, 3 of these tests, which will be the Bolam test, Bolito test, and Montgomery test, are still in use in the England and Wales. And that's all from my part of the England and Wales. And now I will be passing to my group mates for the Malaysia part.
So, how was the development of Bolam test in Malaysia? English common law was introduced into the Malaysian legal system by virtue of Civil Law Act 1956. This legislation continued to be enforced even after Malaysian independence from the British in 1957. By virtue of Section 3 of the Civil Law Act 1956, Malaysian courts have in practice taken into consideration of English judicial decisions and examined its sustainability in developing the domestic jurisprudence. In medical negligence case, Malaysian judges have readily adopted the Bolam test since 1960 as the basis for determining the standard of care in cases concerning issue of medical diagnosis and treatment. In Malaysia, 2 of the earlier cases applied to Bolam test were the Privy Council decisions in Chin Kyo versus Government of Malaysia, Federal Court case of Swami versus Matthews. Subsequently, the Court of Appeal in Dr. Chin Yu Hiap versus Ng Yu Kyon confirmed these approaches in 1990s. So, what happened in Chin Kyo versus Government of Malaysia case? Here, the High Court judge had applied the Bolam test and found that the doctor was negligent in prescribing a penicillin injection to the plaintiff, who was allergic to the penicillins, without seeking her medical history, and the plaintiff died within an hour after receiving the injections. It was on appeal that the Privy Council reaffirmed the High Court decisions, endorsing the use of the Bolam test, which became the prescribed test to determine the standard of care in medical negligence cases in Malaysia. Those efforts had been made by Malaysian judges to place certain qualifications on the Bolam test. So, why do we depart from Bolam test? In 1992, an Australian case, Rogers vs. Whittakers, High Court of Australia departed the decision from Bolam test and overruled it. The Australian judiciary laid out the principle in Rogers and Whittakers, in addition to the duty to advise the risk, was also extended to all aspects of the doctor's duty, including diagnosis, treatment, and care. So, what happened in Rogers and Whittakers case? Mrs. Whittakers has only one good eye. She was advised that an operation on the bad eye would improve its appearance and probably restore significant sight. So she underwent the operations, resulting in her losing sight completely in one good eye. due to symptomatic ophthalmia. The court held that the defendant failed to advise Mr. Whittaker of the risk upon evidence, which only occurs once in approximately 14,000 cases. So, how do we apply Rogers and Whittaker's case in Malaysia? In Malaysia, the Bolam test continued to apply in medical negligence case without any issues under the 1992 Rogers and Whittaker case. The federal court case of Fu Fiona versus Dr. Su Fukman is a significant case in Malaysia medical negligence case which affirmed Whittaker test. So, what happened in Fu Fiona versus Dr. Su Fukman case is the plaintiff, Miss Fu, was injured in 1982 and was admitted to hospital. She was diagnosed with dislocated vertebra and given traction treatment by first defendant, who was the orthopedic surgeon. The first defendant performed the first two operations involving the procedure to place the dislocated vertebra back to the original positions. However, the treatment was failed. The second defendant, Dr. Su, performed an open surgery, also an unsuccessful treatment, and causing her to be left with irreversible paralysis. In 1987, Ms. Fu sued the second defendant for medical negligence, claiming negligence in the first surgery, failure to inform her about the risk, and failure to take immediate remedial actions. In 2002, the federal court decision in Dr. Su Fukman versus Fu Fiona created an ambiguity about the use of Bolam test in Malaysia. The validity of the use of Bolam test was questioned, and it ultimately confirmed the application of the test set out in Rogers and Whittaker's in Malaysian negligence cases. However, via the federal court decisions in Zohasisma versus Dr. Kupu, the apex court reaffirmed the application of Bolam test in terms of negligence involving diagnosis and treatment. So my teammates will share some recent cases in Malaysia to prove that the Bolam test is still alive in Malaysia.
Now I'd like to talk about the application of Bolam test in the Malaysian recent case Muhammad Yusuf bin Abdullah Gani and Dr. Abdullah Wahab Sufarian 2015 case. The Bolam test sets a standard for the medical negligence. As mentioned before in the introduction, a doctor is not negligent if they acted in line with accepted practice among peers of similar skills even if other opinions disagree. This sentence gives a meaning that it allows for differing opinions among experts in Bolam test as long as the doctor's actions aligns with one recognized medical practice. The facts in this case included was the patient was admitted with fever, headache, body ache, nauseous, and vomiting, while the Dr. Wahab diagnosed it as a dengue fever based on the clinical symptoms and continued the diagnosis despite negative serology test results. The issue in this case was the Dr. Wahab ongoing diagnosis for dengue was it reasonable despite negative test result. Fortunately, Bolam test was applied to resolve this issue. The expert witness, Dr. Tan, testified that not all dengue patients have a positive serology test result. He had further emphasized the importance of the clinical judgment in diagnosis and managing the dengue. Therefore, Dr. Wahab's actions were consistent with the clinical approach supported by his body of medical opinions. Under the Bolam test, Dr. Wahab's diagnosis was reasonable as he adhered to the medical practices. The repeated negative serology test did not indicate that he had negligence as he had reliance on the clinical symptoms and the disease progression with the one responsible body of medical practitioner. The Bolam test recognized that the doctor must exercise their professional judgment. In this case, Dr. Wahab's management of the patient demonstrated care and skills expected of a competent practitioner. Hence, the court ruled in favor of the Dr. Wahab as Dr. Wahab's diagnosis and action was reasonable and supported by the expert evidence indicate there is no negligence found. The Bolam test further upheld that Dr. Wahab met the standard of care expected in the medical field. To conclude this case, the Bolam test showed that Dr. Wahab's action based on his clinical judgment and supported by the expert opinions adhere to accepted medical practices. This highlights the importance of the Bolam test in determining whether a doctor meets his professional judgment.
Let's move on to the Whittaker test, which is the second test applied in the Malaysian medical negligence. We will discuss the history of the Whittaker test first. In 1992, the High Court of Australia established in a landmark case, Rogers and Whittaker, that patients have the right to be informed about material risk involved in any proposed medical treatment and procedure. A risk is considered material if a reasonable patient, once informed, would regard it as important, or if the doctor knows or should reasonably knows that this particular patient would consider it significant. Initially, Malaysian courts followed the Bolam test in medical negligence cases. However, this approach shifted with the federal courts in Fu Fiona case in 2007. In this case, the federal court ruled that the Bolam test is irrelevant to a doctor's duty to advise. Instead, the court adopted the Rogers and Whittaker test for this purpose. The federal court also distinguished between two types of duties for a doctor. The first is the duty to diagnose and treat, and the second is the duty to advise. For diagnosing and treating, the Bolam test still applies in Malaysia. However, for advising, the Rogers and Whittaker test applies. This means that doctors must inform and advise patients of the material risk involved. Move on to the slides. In Malaysia, the case of Hassan Daktolak versus Kerajaan Malaysia in 2010 demonstrated that Malaysian courts are not limited to apply Whittaker test just once in medical negligence cases. In this case, the appellant Hassan Daktolak sued the government of Malaysia for medical negligence by its two doctors during two surgeries. He claimed negligence in two grounds. The first is the doctor's lack of reasonable care and skill during the surgery, which led to spinal nerve damage and complete paralysis below the waist. And the second is the doctor failed to inform him of the inherent risk of the surgery, which he stated would have influenced his decision to proceed. Justice Sulaiman dismissing the appeal, and the judge found that the paralysis suffered by the appellant was not due to the doctor's negligence during surgery but was instead caused by the delayed treatment. The trial judge evaluated all the evidence, particularly expert testimony, and concluded that there was no proof that the doctor's actions during the surgery caused the nerve injury, and the spinal injury was severe, and the delay in medical treatment intensified the injury, leading to paralysis. Furthermore, the court agreed with the respondent's counsel that the Fu Fiona case had indeed rejected the Bolam test when determining the standard of care in medical negligence cases. This responsibility to establish this standard now lies with the court, which consider all evidence, including expert opinions. This means that the courts can determine the standard of care in negligent cases based not solely on the medical opinion. Notably, in this case, the Court of Appeal applied the Rogers and Whittaker test not only for advice but also in the context of treatment. That's all for the Rogers and Whittaker test as applied in Malaysian negligent cases.
So in a nutshell, the standard of care of medical negligence in Malaysia concludes two tests. First will be the Bolam test, and the second one will be the Whittaker test. The usage of Bolam test is same with the one that used in the England and Wales that have been mentioned before, where it is to determine whether a medical professional has acted according to a responsible body of medical opinion. Well, for the Whittaker test, it is slightly different compared to the Montgomery test used in the England and Wales, where the Whittaker test, it is to disclose some of the material risks where a reasonable patient would like to know. Both of these tests are in use in Malaysia to determine whether there's a medical negligence happening in Malaysia. We can look at the case of Datuk Dr. R. Ruben versus Datuk Dr. Arifin Haji Omar. This case happens recently in 2023, where the defendant failed to provide a sufficient care to the patient that leads to harm. The court will use both of these tests, which are the Bolam test and the Whittaker test, to determine whether there's a medical negligence happening in this circumstance. For the Bolam test, it is to determine whether the medical treatment and information provided by the medical professional has met the standard of care expected in the professions. While for the Whittaker test, it is to emphasize the patient's right to know the informations about the treatment before making a decision to start on for a treatment or not. Both of these tests is really important for the Malaysia to determine whether there's a medical negligence happening, which will be the Bolam test and the Whittaker test. Here's a final conclude for the standard of care of medical negligence in England and Wales and Malaysia. There were total 4 tests that we have been discussed, which were the Bolam test, Bolitho test, Montgomery test, and the Whittaker test. 4 of these tests are really important for the courts to determine whether there's a medical negligence happening in the medical field. If there's no such standard of care or no such test, it will bring issues to the society. For example, opening the floodgates that will lead to numerous unreasonable lawsuits, overwhelming courts, resulting in excessive litigation costs. And that's why 4 of these tests needs to be applied by the courts in their own countries to determine whether there's a medical negligence happening. And that's all from our group. Thank you.